Are you wearing your white? It is Fibroids Awareness Month. The World Health Organization says that 77% of all women globally will be affected by fibroids by age 50. That's almost 8 out of every 10 women you know. And when it comes to Black women, that number is closer to 90, right? Uterine fibroids are a major public health issue, a large-scale public health issue. And it does affect us in the United States, but it really is, as I said, a global issue. Now, I battled fibroids for 14 years and infertility caused by the fibroids for 10 years. So I know personally what that journey has can be like. And I actually had fibroids 5 times, meaning 5 different fibroid surgeries. I underwent 5 different fibroid surgeries. Now, today, because of that, I want to make sure to bring you all the information, all the education, all the empowerment that you need to navigate your journey and to prevent, you heard me say that, prevent actually going down that road. Here to have a conversation with me today about 5 things every woman with fibroids should know is Dr. Sophia Lubin. She is a board-certified OBGYN gynecological surgeon, as well as the host of the Dr. Sophia OBGYN podcast. And she's my Haitian sister. Sak passe, na boule. So stop, share this live with people in your network because, like I said, 8 out of every 10 women that you know deals with fibroids. Okay, so share this with your network. And brothers, if you're tuning in, you got a sister, you got a niece, you got a mother, you got an auntie. The women in your life need this information too. Period. And that's that on that. So let me officially welcome you before we bring on Dr. Sophia. Welcome to Detox Living, where we bring you truths, tips, and testimonials to power your toxic-free living. I'm your host, Coach Gessie. I am a fibroid survivor turned health activist and founder of the detoxnow.com, a holistic health platform that is dedicated to providing education and supplements to help combat the chronic disease, the obesity, the reproductive health issues, and more that lead to lower life expectancy rates in our communities. So join me in welcoming you did it! Now I want y'all to know this is her first one. All right? This is her first one. I'm cracking the code here.
Not only that, but I'm also overseas and really happy to join. Yes, girl.
Okay.
I'm enjoying the vacay.
Where are you? Where are you overseas?
I'm in Panama right now.
Oh, love it. Well, thank you. We're not gonna
couldn't miss an invitation from you. So
God,
that's why I'm here.
I feel incredibly honored that not only did I get your dedicated time to be your first IG Live.
Yes,
but then
my very first.
That you would take time to do it even while on vacation. That's how much this means to her. So we're going to
That is correct.
Right?
That is so correct.
I like to start every conversation with kind of helping people get to know who you are, right? I introduced you, I gave your credentials, but who is Dr. Sophia Lubin and how did you get to become Dr. Sophia Lubin?
I mean, honestly, I knew from a kid I was going to be a doctor. That's what I wanted to do.
Can I tell you, every doctor I have spoken to so far on this podcast has said the same thing.
Because
it's incredible.
It's a calling. You can only do this kind of work if it has to come from deep within you. It cannot be something you're like, maybe I'll get paid well. Maybe I like it. It can't be like that. Mm-hmm. I was a whole teacher before I went to medical school.
Wow.
You know, I did other things. But knew that working with women and doing the work that I do with women was what I wanted to do for the rest of my life. So every day I get a chance to get up and do the work that I love. And so in a nutshell, that is Dr. Sophia.
And why did you choose that specialty, the practice that she chose, right? The specialty.
I'm a mother of 2. And after I had my first son, going through that pregnancy, which was incredibly difficult, I had 2 kidney surgeries during that pregnancy. I had both of my kids were born prematurely. And so having gone through that experience, I just felt like women needed more women to really just advocate for them, empower them, make them feel more comfortable going through the process. And so, I just knew that that's what it was. So like I said, I was a teacher. And then I decided, I can't teach these middle school kids no more.
That'll drive you to drink. Unless you're called to do it. Unless it's a calling. Shout out to all the teachers out there.
Shout out to all the teachers out there, because that is not,
ain't for the week.
No, it ain't for the week. And so instead I said, oh no, I'm going to go to medical school.
No, yeah, like
and so,
so wait, I want to make sure I heard you. I want to make sure I heard you properly, because, you kind of said it on a humble, like, yeah, I was teacher and then I went through these crises and I decided to be a doctor. So you were a whole mother before you decided to be a doctor?
Yes, of 2 babies.
Wow. See, we got to unpack some of that, because first of all, you said you had a traumatizing birth. Both of your children were born premature. Let's get into your story a little bit about that. Would you mind? Because I'm sure that informs you as a practitioner.
You know what? I think it truly allows me to connect even more with my patients. Having gone through a process, I had preeclampsia, I had everything. You named it, I had it. Wow. You know what I mean?
Wow.
And so, and then of course having 2 babies at 8 months. And so in terms of going to medical school, I was going to medical school specifically to become an OBGYN. There was never, I'm going to go to medical school and figure it out. Like many times people go to medical school and then we try to decide what discipline is going to fit. Right. We do our rotations and things like that. But I went very specifically to become an OBGYN. So I don't know. I didn't get into that.
It had to do with your own maternal health journey?
That is correct. My own maternal health journey.
Powerful, girl. Powerful.
What truly drew me in. I knew that that's what I had to do with the rest of my life.
Now, did you have, what we call near misses? Because preeclampsia, I don't know there to be a case where a woman's having preeclampsia, and obviously you made it, right? Praise God for that. Yes. Thank God you are here to tell your story and save other women's lives.
Absolutely.
Right? So how bad did it get?
I developed preeclampsia during my delivery. So during labor, the labor process is when I developed preeclampsia. Wow. However, like I said, I had 2 kidney surgeries while pregnant, which I think
was it genetic? Did you have it before you were pregnant?
I had kidney problems as a younger, but I think pregnancy itself also lended to the difficulties I had in terms of my kidneys, requiring stent placement twice.
Wow.
And having to be in the hospital. It was a lot for a young woman, And then one of the other things that truly, actually, side note, impacted my wanting to be a doctor and really treat women was the fact that, at the time I was 22, but fortunately for me, I'm very thankful and grateful for this. I always looked really young. And I remember getting those snares and people thinking, the nurses and other just people around me always thinking I was like a statistic. I'm a teen pregnancy, etc. And I was like, it doesn't matter. I'm still going to be a mother.
That's right.
And so the concept was I have to be able to be a guiding light to treat women, all women, with respect. At all times, at all stages, at all moments in their lives. And so that was another really driving force as to why I decided to go into medicine and specifically to be a GYN.
Did you have Black female doctors?
And I did not.
I would figure because of what you said.
I had a Black male OBGYN who was wonderful.
Awesome.
And then the woman who actually was there at the time of my first delivery was an Italian woman. And she was also lovely at the time of my delivery. But all those in-betweens,
right?
All that back and
people
forth
don't realize there's so many people who have hands in your case. Yeah.
Exactly. And I can't say the same for everybody
Wow.
who was a part of my care.
So Mahatma
So
Gandhi called you and said, be the change that you want to see in the world.
as
And
as I say to people all the time, going through your own personal story just makes you that much more connected
mm,
and allows you to have the feeling and be able to give back that same sense of sympathy, empathy, and hope. You know
yeah.
what I'm saying? I think it's important that women understand that they can be hopeful, like they don't have to go through things alone, and that other people have gone through things before them. And I'm so fortunate that I'm able to not only have gone through it, I had two children through it, and always telling women, if you want to be a doctor, then be a doctor. Don't think you can't do it, and just have the conviction and knowing that it's what you truly want. Because like I said, doing this kind of work certainly isn't easy, but the rewards are so strong.
Phenomenal. Now, I want to go back to the preeclampsia for a minute because, there were recent studies that showed that women that developed and dealt with preeclampsia during pregnancy have a risk of elevated risk of heart disease for
That
up to
is
20
correct.
years, right?
That's correct.
Past birth, right?
That is
After birth.
correct.
And how was that managed in your case in terms of the heart, risk of your heart? Because now they're actually, which is good, they're referring women who have dealt with preeclampsia during pregnancy to cardiologists, right? Which before was not necessarily something being done. What was your case like? Because preeclampsia, as you know, high blood pressure has taken out preeclampsia, which is high blood pressure during maternal pregnancy,
So,
has taken women out. Literally, has taken women out. Right.
absolutely. And to be fair, I mean, like I said, I was a young mom. I had all the quote unquote risk factors, right? Being my first pregnancy, being young, being Black. Though that one,
Yeah.
anyway,
Well,
we'll
the
talk about
conditions
that.
of we're
That's a
talking,
whole
and
different
really, it's
thing.
the bias connected to it, right? It's not
Yeah,
the actual
yeah,
skin color,
exactly.
right? It's not the melanin.
But nonetheless, what I will say is that, I'm sorry, I'm moving this. What I will say is that I have hereditary high blood pressure, right? My mom has it. I have it, and I've had it since I was 30. And it doesn't matter. I've always been a slim person who's always exercised, who eats well.
Yeah, so there are
And I
genetic
still have
factors.
it.
So it's not,
I
and it
still have,
actually can be connected to. So you and I, kidney disease. So kidney disease and
yes,
high blood pressure go hand in hand. I have a
that is
genetic
correct.
condition called polycystic kidney disease,
Yes,
and that condition causes you to have elevated. It affects your blood pressure.
that
So
it
it doesn't
can.
matter. Like my doctor says, there's nothing I can tell you to do to live healthier because you're literally doing everything,
Yeah,
but you have to be on
you
medication.
are the poster child of healthy.
Right. He's like, there's nothing I could tell you to do, but because of the kidney issues, the chronic kidney disease, that affects your blood pressure, period. So it's like whether or not it wasn't something where your lifestyle factors would have changed, your blood pressure. Your blood pressure, your risk factor was connected to your kidney conditions.
Kidney condition and hereditary, So yes, that is absolutely true. And it doesn't help, obviously, that I had preeclampsia. So that's just an added risk factor, right? For me to develop high blood pressure. And it's important for women to understand these kinds of risk factors, understand their own, the things that can contribute to their health and risk of disease processes in the future. And so it does help me, though, to know that I always have to maintain a certain weight, maintain a certain lifestyle in order for me to always try to be as healthy as possible.
Right. And was it recommended to you, because here it is, the doctor becomes the patient, right? Was it recommended to you to monitor your pressure at home on a regular basis? Like I have to monitor my pressure at home on a regular basis in order to know my numbers actively and not wait till I go to the doctor.
Right. And so I can't say that with 100% certainty that was really communicated to me after I gave birth. I mean, like I said, we're talking about 20, 25 years ago here now.
Right. And she looks 20 to 25 right now.
So yeah, Tyler's going to be 25.
Wow.
So it's a real thing.
Wow.
But nonetheless, what it was is that preeclampsia is a blood pressure issue that happens during pregnancy and more oftentimes during the latter part of pregnancy, delivery, and post-delivery. But it does go away, right? So the blood pressure.
Sometimes. Most times. Let's say most
of the time, it's a temporary condition. However, it's a temporary condition that can obviously have detrimental effects.
Absolutely.
And in real time, it can be to the point where it can cause mortality. And so we cannot play games with that at all.
No.
However, the understanding that if it is treated, number one, and caught early, number two, and it does go away, because the cure for preeclampsia oftentimes is exactly that: delivery. Delivery is your cure for preeclampsia.
Unless it's too early and they have to treat.
Unless you have it early. There's all kinds of other
factors, right?
Factors around it. But overall, let's just talk about the general concept around it. And so, when you get to the 6-week mark, most women who had preeclampsia no longer have preeclampsia.
Gotcha.
And more than that, their blood pressures
6 weeks postpartum. 6 weeks postpartum.
Their blood pressures tend to normalize, and your body starts to want to return to its pre-pregnancy self. Now, that process takes up to a year. However, we already start to develop all of those changes. Things go back to a more normal state or pre-pregnancy state.
But it is not safe to assume, because again, as the recent studies have shown, the risk factors of heart issues.
No, doesn't take anything away from heart.
That risk 20 is years past. That risk is now there, but that's why you have to.
That risk is there. You had it. You have the risk. Yep. It's not. Let's not mince words here.
Nope.
What I want to get women to understand, though, is that having had preeclampsia, it's your blood pressure
can return.
Typically will go back to where you were before pregnancy.
Right.
Certainly in the short term. And then women still continue to have to monitor. That's why it's so important that we do have regular appointments with our physicians. Our medical providers,
blood pressure monitor right here.
Blood pressure cuff, exactly. And even after delivery, it's important that they have the blood pressure monitoring, and that is happening at home.
And we talk about also, because of the elevated risk for Black women, that again, we know that we have the trauma of racism that we deal with on levels that causes us to be in inflammatory states in general, right? Yeah, just like in general, life, just the air that Black women breathe is causing
every day
an inflammatory response every single day. And because of that, during pregnancy and even outside of pregnancy, but because you have an elevated risk during pregnancy, you should be measuring your blood pressure at home. Period. Whether or not your pressure is elevated when you went to the doctor, because you want to get ahead of it, in front of it, you want to know your numbers. That's the number one thing you can do, is know your numbers, right?
So I think that it's important for women to definitely understand the concepts of prevention. Yep. And that prevention means understanding their own body, really understanding how they're feeling, knowing, like you said, knowing their numbers. I also don't want to be an alarmist. I also don't want to be someone who's going to say every single woman, every single time. Yes, we all have, we can be armed with information. And I think it's the importance of understanding when you do go to your doctor's visits, was my blood pressure normal today? And understanding that, and so that if there are any small changes, or if you yourself within your body, you start to feel anything at all, then that may be a trigger for you to say, hey, let me make sure that my blood pressure is normal, et cetera, et cetera. Because at the same time, sometimes just checking your blood pressure can cause people that sense of anxiety.
I don't know, but Dr. Sophia, so here's the deal. I'm focusing on educating women that let's make it a normal part of our life. Let's make it a normal thing, because quite frankly, often women, when they go to the doctor, they have white coat syndrome, and then they end up having elevated numbers that they don't really believe when they go to the doctor. They're like, oh yeah, I was rushing.
Those women and those people, I always tell them, I send them home with a blood pressure cuff.
Yes, because they're all home
when you're relaxing, when you're home, etc. But at the same time, when we say everybody all the time, I think
for 2-week periods at a time. Like, okay, let me just see where my baseline is, see where I am. Okay, boom.
So people should definitely know what their baselines are. Exactly. You know what I'm saying? I agree with you. Understanding what your baseline is, understanding what are the things that you do on a regular basis that can make changes to that baseline. So whether it's how you're eating, your exercise,
Sleeping,
if you're
exercise.
sleeping, and
Yep.
things like that. So adding those kinds of components to it, it's not just checking your blood pressure.
Absolutely.
I think that's really what I want to make sure we bring home, because checking your blood pressure and not understanding what's happening around it that could be affecting it, or it can change it and manipulate it, etc., is like speaking in a vacuum, and we can't do that.
No, absolutely. So we need to know, but the thing about it is, because it is a silent killer, a lot of women will just not even know, right?
Yeah.
You know the stats. Whereas if more than 50%, it's close to 60% of Black women have high blood pressure and don't know it, ages 20 and over. Like, in order to know it, you need to know what your numbers are. Because quite frankly, by the time you know it, by the time you're having the headache, by the time you're having any kind of symptoms,
No, for sure. It's definitely a silent killer, but it just brings back the concept. Healthy lifestyle includes, in terms of self-care, that includes regular checkups. That includes, it just does, we have to understand that. And thank God that we live in a place where we have an opportunity to do that. We have that kind of access, and we can create that kind of access for ourselves.
Access. Amen. So our topic for today, even though that was great, I'm so glad we had
but I like it.
That was great. Having fibroids causes you to have high blood pressure. So there is a very direct connection, actually, and even studies are showing it more, between high blood pressure and fibroids, right? Where treated blood pressure has shown less in terms of occurrences and symptoms of fibroids. If you have untreated high blood pressure, there's more occurrence of and manifestations or symptoms of fibroids. You want to talk a little bit about that connection?
It just goes back to the basic concept of, when we have high blood pressure, and I'm not talking about the kind that, no matter whatever you do, but we have to remember that it has a lot to do with the inflammatory process within our bodies, right? And so how stress is also affecting us. So one of the number one causes, I think, having fibroids is totally multifactorial.
Totally.
Genetic, it has lifestyle, it has how you're eating, it has all these things that
vitamin D deficiency,
vitamin D deficiency. Like, there's so many things that are affecting women and the development of fibroids.
Absolutely.
However, I think when we think about those kinds of correlations, let's say between blood pressure and fibroids, I think we need to dive more into the concept of lifestyle, stress management, anti-inflammatory diet.
Absolutely.
And
you preaching my sermon.
I know I'm preaching.
You preaching my sermon all day, every day. All day, every day.
You are not the person I'm supposed to be talking to. This is why we're talking to everybody else, because you already know all this.
No. I'm saying that's so true. Literally, I'm amening you. I'm amening you that is. It really goes down to the core that's causing both, right? And when you look at, for us, yes, fibroids are multifactorial, no question, right? But when you look at the top factors, you're talking about stress, like one of the number one causes of the development and growth of fibroids, stress, right? And then you're talking about hormonal imbalance, estrogen dominance, right? And you're talking about vitamin D deficiency. Black women are disproportionately affected by all those three things.
That is correct.
Top three things disproportionately.
That is absolutely correct. Stress, we talked about it. You opened it with the concept of institutionalized racism, or just the concept of the stress of life on us all the time, right? The historical traumas, the generational traumas, and all those things that we carry, and that we're bringing forward every single time, every generation. So if we don't start to break that cycle, then we're never going to break the cycle of stress.
That's right.
Of that feeling of heaviness that lives literally within our bodies.
That fight or flight. That place of
that we're constantly in.
Fight or flight.
We're constantly in. So that's one. But two, when we talk about, the concept of hormone or estrogen dominance and that kind of thing, it's bringing back the right kind of fruits and vegetables to our diets that are not necessarily readily available in our community. Or
food security,
that way of eating is not necessarily passed down, generation to generation to generation. And so all those things are factors in why.
And let's not forget the products that we use that are marketed to Black women, right? Everything from the environmental work
it
group.
just get
It is
yes,
legal.
because those disruptors,
Yes, the
it's
hormone
crazy.
disruptors. It's
Yes,
legal.
those hormone
it's legal.
disruptors are really wreaking havoc on our bodies.
It's legal
So
to
that,
poison us. It's legal to
especially
poison us, literally.
in this country.
Okay, in this country, because the study that the environmental work group did, it showed that 78% of the products that are marketed to Black women are actually toxified with harmful ingredients that lead to reproductive damage, hormone disruption, and cancer.
Absolutely.
Right? 78%. That tells
It's crazy.
you,
It sounds wild.
you have to literally scan everything that you buy. Make sure that the products that you're using are clean. So it is the hormone disrupting products, and then the pesticides used on the foods, the dyes, the gluten, right? All the things that you go and eat out overseas and abroad, and it's not even allowed. It is literally illegal in products, right? That's why, especially in the US, it's legal to poison us. So
It's legal to poison.
and those foods are not
that is the number one fact.
Yeah, and they're not available in our community. You have to go outside of the communities to get the holistic, the organic, they're not in our communities, right? Just that, so the disproportionate effect. And then we're going to go to vitamin D deficiency, right?
Right.
Melanin.
So the other thing is that despite, yes, our melanin protects us from a lot, but it also blocks that natural vitamin D from coming in.
Mhm.
So outside of that, we also have to understand of how to pair that vitamin D with other supplements, like vitamin K, for example, in order for us to better absorb that vitamin D. So those are other little things that not only that, but unfortunately, all of our providers, we're not all built the same. And I'm not talking about anybody specifically, obviously, but the reality is that.
Oh, you about to drop names?
The bottom line is, as my friends would say, your cousins, those must be your step cousins, who just are out here and they let people live with their vitamin D deficiency.
And guess what?
All kinds of other things.
Our vitamin D is also formulated. One of the things what we want to make sure is we make sure that our vitamin D is formulated also with the healthy fats that help your body absorb them. That's the other thing they don't tell you, right? You want to make sure
correct.
Your
that
body
A, D, and K are all fat-soluble vitamins. They need to be absorbed
right.
with the right kinds of fats.
And that it's D3. It's cholecalciferol, so your body's getting the most bioavailable form of D3. So we talked about the multiple factors. Now, the topic I said were the 5 things that every Black woman should know, right? Dealing with fibroids. And I broke them down because I wanted us to discuss them. And number 1, we hear it all the time, is that, it is a chronic issue, but it's manageable, right? Because it's not, people think fibroids, oh my God, my life is over. No. You can live with fibroids, all right? Meaning like your life can be healthy. You can actually have lifestyle changes that help your body to help you to prevent them. As far as if you look at the signs early on with the heavy periods, that's telling you something's wrong. Right.
So we should start by even letting women understand what some of the symptoms of fibroids may be, because of the fact that for the majority of women, they don't even know that they have them.
That's right.
And they may never know that they have them. And so what some of the symptoms are in terms of understanding fibroids, right? So if you start to have a brand new heavy period, might be a sign that you have a fibroid in some location of your uterus. If you start to feel this constant bloating, that may be a sign that you have fibroids. You start to have urinary frequency, that may be a sign that
that's grown and it's now pressing on your bladder.
Yeah, you may have new onset pain during sex. That may be an indicator that you have fibroids. Just fatigue in general, especially during the time of your period, etc., may be another indicator that you have fibroids. If you are anemic, maybe another indicator that you have fibroids. So the list goes on and on, but if you're not paying attention to how your body feels,
right,
and what's going on in your body, then it may be harder for you to know if whether or not you have fibroids. The other thing I say is, when you go for your annual checkups, you go to see your GYN, pose it as a question, doc, is there anything, any signs at all that I may have fibroids? Is there a way for me to check to see if I have fibroids?
Yep.
If I know that I'm having this particular change in my menstrual cycle, or I'm feeling this particular way when it comes to using the bathroom, having a bowel movement, etc. And my concern is that I may have a fibroid. So if at the very least, they should do a physical pelvic exam.
Right.
And to see if they are palpable, and if they are not, then to see if perhaps they can send you something like an ultrasound.
Right.
These are very two simple things in order for us to identify whether or not there's a fibroid that could be causing some of the symptoms that women are experiencing.
That's very good information. And another thing, because we're trying to help women see the warning signs, one of the things that we work to educate them around is the fact that a heavy cycle is not normal, right? So a heavy period is not normal. If you always have a heavy period,
it's not supposed to stop you from doing life.
No, it's supposed to be a blip in the road. It's supposed to be a natural thing where you have you can have a little discomfort. You can have, little spotting, light bleeding, but it is not supposed to stop you in your tracks, right?
Yeah, it's not the crime scene.
No, it's not. And the thing is that, there have been so many physicians that say, Black women just bleed heavier, or, oh no, it's just like, that's just normal.
Yeah.
Or you're having severe pain. Oh, just take ibuprofen. So that has somehow ingrained in women that, okay, they're normalizing something that is a warning sign saying, hey, things are headed in the wrong way.
100% agree with you. The amount of times that women come into my office and I ask them, I says, well, how many pads do you use or tampons do you use during your menstrual? Or, are you able to use a menstrual cup? When they say, I can't use a menstrual cup because my period is too heavy. And I'm like, okay, then that's something we need to talk about. We might need to do some investigating here. What's going on? Or they tell me that they have to use a super tampon plus a super pad. That's an overnight, or they're using, period diapers or whatever the latest and the greatest thing is out there. That tells me there is a problem. But we also have to actually ask the question because, like you said, so many women this has become so normal for them that they don't even know to mention it as a complaint.
No, because all their girlfriends are telling them it's normal.
Right. As
the doctors are telling them it's normal.
So yeah, I get it. I totally get it. You're absolutely right about that.
So I think that has been a major effort in general, has been educating so that, okay, let's stop it before it becomes an issue. Because when you're having heavy periods, it can be in the hormone imbalance state where you can make the lifestyle changes before you develop fibroids, before you develop other issues, right?
Absolutely.
So that you can say, wait a minute.
Like if we understood better just exactly what's happening within our bodies, and then to know what's normal versus what's not normal, well, more likely to bring those things to the attention of our physicians. And it's important to bring that to their attention because they may not be thinking about, they may do for example, your pelvic exam, everything that may feel normal, but you may have a fibroid that's on the inside of your uterus that's not palpable.
That's right.
And so therefore,
it's causing crazy bleeding.
Yeah, and then it still causes crazy bleeding. It still causes major problems for you. And, it could be missed on the physical exam.
Right. You can't touch it in the pelvic.
Yeah, it's not touched.
So as one of the things I know.
Sorry.
I know.
Just look at what's on here.
One of the things I know is that, Mel asked a question. Do you want to answer that question?
Oh, I can't see. What was the question, though? I just see that.
Do you think after the COVID shot, many women have heavier cycles?
I do. I can say that anecdotally. I don't have a study that I can use to prove that.
Okay.
I think after COVID, so it's hard for me to just pinpoint it.
It's not necessarily the vaccine.
I can't say it's pinpointed to the vaccine. What I can say is that COVID in general has made a lot of changes for a lot of women, for a lot of things, whether it's fertility, whether it's periods, whether it's just weight gain. I've seen the amount of weight gain that I have seen in women since the pandemic, and we have totally so many reasons why. just staying home, sedentary, etc.
Right.
And the, anxiety, depression, like we have just all kinds of
Right.
reasons.
Right. The
However,
overlaying.
I can say anecdotally that it is definitely something I am noticing.
Gotcha. Okay. So one of the things we talked about is the fact that you also are a gynecological surgeon, right?
Yeah.
So you deliver babies, you care for women, but then you also are a surgeon.
Absolutely.
And, one of the things that we talk about all the time, because unfortunately, I realize no matter how much I talk about it, it's not enough because there's so many physicians out there that treat fibroids with a one solution, which is a hysterectomy.
Yeah. No.
And it is absolutely heartbreaking when I see cases where a woman has I look at him like that didn't need a hysterectomy. Like,
moreover, I think
you know what I mean?
It's the fact that unfortunately we're too many physicians. We have not enough time to spend with patients to understand what their true wishes are, to understand what's going to be best in terms of for their life at that moment, right?
What about skill level? So that's one thing. That's whether or not the patient wants it. Because I've had many patients who said, no, I want to have children. No, I mean, I'm fighting. So I've had many patients who say that, but they're being offered that and saying that their case is so severe when they just...
And that's not true. I mean, the thing is that you're speaking to someone who's taken out things, 59 fibroids out of a woman in one shot who wants to still have children, and where she was, she was seen by other providers and came to me as a third, fourth, or fifth option, her opinion, in order to have the option of still being able to keep her uterus. And the practice that I used to work in, thank God for Dr. Comrie, anybody Dr. Comrie fans out there.
Right.
But the reality is that the kind of work that we were doing, and I continue to do, she continues to do, is to offer women the opportunity to keep their uterus, especially if they are thinking about their future fertility. I think it's a travesty to only have a one-track mind when it comes to fibroids. And I definitely see that women of color are only many times the offering is
that right there.
This is what's this is what you need. No one's really talking to them about their possibilities. What are their options? And it's just,
there's so many options now.
And most women don't even know. I'm like, well, could you consider something like a uterine artery embolization if you don't want surgery? So many women are scared, and we have to understand that, with rightfully so. At the end of the day, some of if your fibroids are really large, and we do need to do something, let's say, called a myomectomy, meaning an abdominal cut on your abdomen, that in order to remove them, right? That is major abdominal surgery. It comes with all the risk factors of major abdominal surgery. Right. And so for me, it's like, I am not just going to offer that lightly. I'm not going to say you need to have this or that. You know what I mean? And so the bottom line is that you do have options. It depends on the location. It depends on the location of the fibroids. It depends on the size of the fibroids. It depends on the symptoms that you're experiencing in terms of your fibroids. And so it requires a much more robust conversation.
And skill set.
And skill set. Because in my hands, I would tell anyone who has major fibroids, really big, etc., that those are the kinds that I handle the best, right? But let's say I'm not a robotic surgeon, for example. Okay. So in my hands, I would never say, come, let me do a minimally invasive robotic procedure for you. And that's not my specialty. That's not what will come to me, And I have plenty of friends that I could refer to who are robotic surgeons who can do an amazing job. And so that's one. And then two, it's understanding who are the best candidates for the different options that are out there. Who is the best candidate for a robotic procedure? I'm not sure that if you've ever been told, oh, your fibroids, you look like you're 5 months pregnant, that is someone who would benefit from a robotic procedure, for example.
Because what? Share why.
I will share the reason for me personally why it's not my choice to advise that. I would say then go speak to the surgeon who would do the procedure. But in my case, if we're doing a robotic procedure, and especially if we're doing it for fertility preservation, then a large fibroid that may be occupying all layers of the uterus that is taken out in a minimally invasive way, that's great. However, my concern is always going to be how are we closing all of those layers? And though there's a lot of surgical technicality that comes with, let's say, doing a robotic surgery that allows one to close those layers. But my concern is always going to be, the pregnancy afterwards, right? And what I can feel with my actual hands, for me, right? So in my hands, that's how I would consider it, right? But if someone has a solitary, let's say what's called a pedunculated, meaning if this is your uterus, the fibroid is sitting on the outside, on a stalk. It has a stalk, and you're able to like trim that off, and your uterus kind of still remains intact, and there's not as much manipulation with the uterus itself in a way that doesn't allow me to have my actual hands on it, then that may be a different kind of conversation. But like I said, my thing is speak to the surgeon who's going to do your surgery. That's the person who's going to really be able to tell you what's possible, what's not. In my hands, I wouldn't consider it.
What are your telltale signs because you mentioned a case where you were like the third or fourth case, right?
Third or fourth opinion. Yes, right. Absolutely. That's
third or fourth opinion. Sorry. How many times does that happen? How many times do you find that, women are literally advocating for themselves, fighting to find the right physician to listen to them and actually help them to achieve the vision they have for their bodies, whether it's preserving their uterus, removing all the fibroids, no vertical scars, all of that, no vertical incisions. Like, how often would you say that you see that?
I would say often enough. I can't put a number to it, but certainly I have women who come to me or, come in to see some of my colleagues because of the fact that the only thing that they've been offered is a big vertical incision. Oh, your fibroids are too big. It has to be a vertical incision, number one. Or number two, that we can't remove your fibroids. There's just too many or too big or too what have you. Or we can't preserve your uterus. And I think a woman who comes in and has the desire for fertility, having a conversation that puts that completely off the table, is not a robust conversation. It should just be a two-way conversation. Now, granted, are there reasons why perhaps someone who may have had multiple fibroid surgeries maybe has multiple other issues going on? It's still,
if it's a life-saving surgery, like that's what there's a life-saving surgery.
Listen,
it could be a life-saving surgery for you.
Absolutely. Right? And there are individualistic reasons why we have to take into account which options.
And some people just want it. Some people, they just want a hysterectomy.
And
right.
I was going to go to the fact that a woman who is completely done with childbearing, entering close to menopause, however, having really severe symptoms that are associated with the hormonal changes that happen during menopause in terms of heavy bleeding. So that bleeding is now potentiated by having the fibroids. Okay, so someone who's having like super heavy periods before, let's say at 35, now is 48 and is completely done, has their children grown, small, whatever they are, but completely done with their fertility, and has a fibroid uterus that is, let's say, makes them look like they're
what we call advanced fibroid disease, what we call it.
Okay. And so what I would say to that woman is, I wholeheartedly, if you tell me you absolutely want to preserve your uterus, okay, we can have that conversation. But at the same time, it's not going to change the hormonal thing that you have going on per se, in terms of what's happening with your hormones that is affecting you. And
meaning to remove the fibroids will not save that. Speak more about that. So if they have, because that's the other thing is when they do, like for in my case, right, I was probably that case where they said, you know what, at this point, you've had 3 myomectomies, The fibroids came back. I had small bowel resections in between because of complications from the fibroid surgeries, from all the scar tissue that caused the small bowel obstruction, not once, but twice. And even, I've had 5 small bowel resections
I know you
altogether.
with those
Right.
surgeries and those
So,
small bowel
but
obstruction. Let me just really quick, small bowel obstruction is a complication of
oh, we've talked a lot
major
about it on
abdominal
my podcast, but definitely since in this conversation, go ahead and define it.
in major abdominal surgery, it is always going to be a possibility that you can have something called a small bowel obstruction, which is where scar tissue then can twist and literally strangulate your bowel.
And other organs.
And
right?
other
But it has to
organs,
be
that's
small
correct.
bowel.
And other organs,
Mhm.
causing something called a small bowel obstruction, which can be life-threatening and
Absolutely.
oftentimes is. And so I just want to point that out really quick so that your audience
And that
understands
comes, and that's actually a lifetime risk, meaning because
Yes, that
scar
is correct.
tissue is something
Even
your
things
body
from
forms.
C-sections. I like to point this out, right?
That's
So
right.
a lot of women say, "Oh, I just want a C-section." And I like to point out
Yep.
major abdominal surgery.
That's why we say the
It
same
still
thing.
holds the risk.
C-section has that
Things
risk for a
like a small
lifetime.
bowel obstruction.
People
Yes.
say, "Oh, I had my babies 10 years," and you can still develop a small bowel obstruction
That is correct.
15 years down. I know cases personally,
Yes,
okay,
this is
who they
correct.
just out of nowhere, just because that scar tissue that your body forms in order to heal. You cut, your body has to form scar tissue in order to heal.
get everything back
Right.
together.
That's the normal
Yes.
thing it has to do to heal. It's the normal. But what can happen is that scar tissue develops
That
something called abnormal
contracts
tissue,
different organs.
abnormal tissue proliferation, where it grows abnormally, right? Where it becomes, it goes through an inflammatory state where it grows abnormally and now starts to wrap around other organs or stick to other organs. And it was fine 5 years ago, 5 years now.
Not fine now.
That's literally why we created our prevention kit, because it tackles chronic inflammation, hormonal imbalance, and vitamin D deficiency that all affect inflammation, tumor, help to keep it literally. Because we're like, okay, if you're going to have a surgery, you need a nutrition plan, supplementation plan to help your body fight against that kind of complication. Because down the line, people are like, oh yeah, 10 years down the line out of nowhere, right? So, but going back to the hysterectomy. So I was one of those cases, and they said, just have a hysterectomy. Well, they didn't take my ovaries, right? I was 44 years old because they wanted to keep me hormonally, balanced. But because of all of this, the surgical complications, my medical complications, I still went into full-blown menopause, ovaries and all, right? Never would want what I went through for anybody, right? So in those cases, you think if you remove the uterus, you'll still be okay as long as you leave the ovaries. I've been told over and over, that's not a normal case. Well, unfortunately, it happened to me, right? But typically speaking, from the case you just mentioned, the case that you brought up was, it would not be, if that person is dealing with heavy, heavy bleeding in that case where it's disruptive, removing the fibroids would not be as helpful as removing the uterus. That's the case that we were talking about.
Right.
Because you were saying what would happen in those two cases if you remove the fibroids versus if you did the hysterectomy.
So what we have to understand is, what is a hysterectomy? Hysterectomy is removal of the uterus itself. Mm-hmm. There's multiple parts to the reproductive system. Right. So we're not necessarily talking about tubes. We're not necessarily talking about ovaries that hang out over here.
Cervix.
Or even the cervix, which is the lowest most part of the uterus. So we're talking about removing the part that has multiple fibroids or things like that that's going on in there. And I think it's important to have a very honest conversation. Mm-hmm. And in that honest conversation, it has to take into account both what's going to be surgically optimal, mm-hmm. Meaning sometimes doing a myomectomy or what's called removing just the fibroids can actually be more bloody than mm-hmm. doing a hysterectomy, mm-hmm. for example.
More risk.
So if I'm doing
more surgical risk.
More
mm-hmm.
surgical risks in the sense of bleeding, for example. So
right.
I'm dealing with someone who's already
and more scar tissue,
severely anemic, who's already having, major issues in that regard, and then also tells me, under no circumstance do I want to have any more children. Under no circumstance am I thinking about, a future fertility, right? But the way that this particular problem is affecting me now, I can't work. I'm having, I can't
Our
function.
quality of life and
My
function.
quality
Yeah.
of life is so disrupted. Then we have to have an honest conversation as to what is the better procedure perhaps in that case, especially in a woman who is, let's say, closer to her menopause as opposed to a woman who's 37, and I may still have to have that same conversation with a woman at 37. The difference though is that if she at 37 is coming to me and saying, Dr. Lubin, I want to do everything possible in order to preserve
my uterus, right?
I would like to have a child, then that is a completely different conversation. Actually, it's not a different conversation. Let's be clear, because it doesn't make the surgical risk is still there.
Yes.
The problem is still there. The heavy bleeding is still there if that's the issue as the symptom, right? But we have to take into account what women are feeling within themselves, what their desires, their future desires are, and how to advise them in a very honest way. So in my opinion, if I have a woman who has fibroids that make her look like she's 9 months pregnant already, okay, and she's never had surgery, or she maybe has had, like you, has had 2 fibroid surgeries. And their fibroids
there's 4 at that time, but good. No, 3 in a UFE. 3 in a UFE plus 3 small bowel resections. Actually, the hysterectomy was terrible because I had all that scar tissue. I had like 20 days plus recovering from the hysterectomy, so I think every case is not the same. And you want to make sure.
Definitely not the same, but it requires, the thing I really want to bring home is that it requires an honest conversation.
Right.
And if you're going to a physician who's completely not listening, then that's when it's time to move on to the next person.
Absolutely.
Because it requires an understanding, of the skill set, what they feel most comfortable with. You also can't go to a provider and be like, well, this is the only thing that I want, if that provider can't do that for you. Like I just told you, I'm not a robotic surgeon, right? So having someone come to me and be like, well, I only want a robotic myomectomy, then I'm not the doctor for
and that's okay. And that's
completely okay.
Yeah.
That is completely okay. And likewise, if you're in a situation where you're expressing your desire, let's say, for future fertility, and you're having a real conversation about what and in those conversations, I don't do things in a vacuum. I'm not only talking to you about your fertility based on your fibroids. I'm talking to you about your fertility because I want to know what's going on with your hormones, what's going on with your ovaries, where is our ovarian reserve, all those things. Because talking to me and saying that you want to have future fertility and you have, poor ovarian function, and you've never stopped and no one has suggested to you that you speak to a reproductive endocrinologist, you speak to actually a fertility specialist. I'm not doing anything if you haven't had that conversation, because I need you to be really real with me when you said you want to have your future fertility. You had a kid, and this
well, I mean, if the person's early on,
women to fully come in with what they really want.
Yeah.
This is what I'm saying. Be committed to what you're really saying. Don't say it just because you think it's what you need.
But if it's early on if you're early on and you're not ready to see a fertility specialist, and you're just saying, look, I know.
No, I'm still talking about, but you have to understand, women say this all the time. They come all the time. They think that this is what my friend did. This is what this and that and the third. And they say things without fully understanding. And that's the reason why it requires an honest conversation. Okay. It requires having the information, and not all of them have the information. But for me, if someone comes to me and says that I know I want to preserve my fertility, and let's have a real conversation about what your fertility is like in the first place.
Okay.
That is my point.
Got it.
Then if you say that to me, and let's say you are 47, well then I'm going to be honest with you and say, okay, but you're 47 right now. Have you seen
a fertility specialist?
A fertility specialist.
Right. Like let's not operate in a vacuum.
Exactly. That's my point. So women have to understand exactly what
all the factors.
All factors. It's not one way. We have to look at the whole entire individual all of their needs and make sure all of those things are being addressed even before we get to the bottom, before we get to the point of putting you on the table.
And let's not even talk about just their overall health, right? Because all of that is an effect on their fertility, their overall reproductive health, everything from their nutrition to, you know,
I can't say that enough.
their sleep
What are we
habits,
doing
their supplementation,
lifestyle
everything.
wise? What are your supplements that you're taking if you need to be taking them, what have you? How are you making sure that you have great liver function? How are we making sure that you are exercising? How are we, you know, what are we doing?
It's funny. We had a
really have true wellness.
We had a woman on last week who we call her our OG miracle mommy. She was our first miracle baby testimony, and she was unable to conceive for 12 years. And she and her husband, she was dealing with fibroids as well, and she just started being very proactive about her overall health and looking at what was in her power, her nutrition planning, and, you know, her habits, her products that she was using, and her supplementation. And then right when she was, you know, ready to take things to the next level, she came into contact with, you know, really it was my prayer group at the time. And then I started doing work with, you know, fasting and supplements. And she did our water fast. She and her husband did our water fast. And she was pregnant it was literally about 6 weeks after that. But it was a journey. It didn't happen in a vacuum, right? It was everything from her looking at, wait a minute, overall taking control of her overall health, right? Like improving and taking, what I say is like, it is real healing, and holistic health is integrative. It is working with your traditional medicine and holistic practices, and taking control of your overall health by integratively looking at everything, as far as everything from what your doctor's recommending to, okay, wait a minute, but what's in my power to do, right? What do I have the power to do? So
I think totally a lot of women don't realize how much power they actually have,
God.
and certainly don't pay enough attention to what the signs that their bodies are actually giving them. And so it's part of the reason why I have the motto of embrace your body, embrace yourself with the Dr. Sophia podcast, Dr. Sophia OBGYN podcast, because in every single episode, there is an opportunity to understand that concept of embrace your body, embrace yourself. In order to lead you to real prevention and wellness.
I love that.
And that's
I love that. I love that, because
aspect.
We always say that your body is your number one test. Your body is telling you so much all the time. And if we would tune into what our bodies are telling us, there's so much that we would benefit from it in terms of healing and health. So I love that. Embrace your body, embrace yourself. I love that. So last question, because I know I've kept you and you're on vacation. So thank you again for this tremendous conversation. First conversation of Fibroids.
Yay! First IG Live. Thanks, Coach.
Yes. Is there anything else that, you know, you wish every woman, you know, I love what you said. One thing you just said to every woman is embrace your body, tune into and listen to your body, get to know your body so that you can truly release who you really are and optimize your health outcomes, right? Your potential, right? Is there anything else that you would say specifically that you want women with fibroids to know that we haven't said tonight yet?
Hey, number one, I think we have said this, but I'm just going to list them.
Okay.
You can live with fibroids. Women have fibroids. 70 up to 80% of women have fibroids. There's not a C-section that I've done that I haven't seen, even a little baby one. So, and I have done a lot. I have, you know, seen a lot of women. There's not a cadaver that I saw when I was in medical school that did not have a fibroid. So that's number two. The fact that you have them is not a death sentence.
That's right.
So when you get that news, it just means, what else can I be doing in order to change my lifestyle so that I don't allow this thing to continue to grow in my body or to cause me symptoms, etc. So thinking about how we're eating, our lifestyle, what can we be doing outside of whatever, you know, treatment plan per se, right? That's for sure.
Stop right there. And if you're wondering, you're one of those people, we're doing a 30-day fibroids group challenge, right? I'm hosting it. It's starting in August. So go to the detoxnow.com. It's right on the homepage. Sign up. I'm doing free sessions weekly. So if that's you, you're not alone. This is your opportunity. 30 days of trying to get, literally working to get free from fibroids. All right. So go ahead.
Okay. And then from there, understanding that a hysterectomy definitely is not your only option. And, you know, at the end of the day, fibroids kind of talk to you in the sense of it could be something that's passed down. Like we said, it could be hereditary. There's so many different reasons why women have fibroids. They can be in so many different locations, which is why they can be, some women have them and don't know. Other women have them and know because they're having so much horrible symptoms from it. But they can all be managed. It can all be managed as long as we are
paying attention to our bodies.
Paying attention. And then my last thing, always advocate for yourself. If you feel like something's not right, ask your doctor. If you're speaking to your doctor and they're not really addressing the issue, go to another doctor.
Fire that doctor.
Go to someone else. And when I say doctor, I mean healthcare providers. It could be your nurse practitioner, it could be your midwife, it could be, you know, a PA, even in the practice. But the bottom line is see a healthcare provider that is going to listen to you and order
with you.
I love that. Absolutely. Partner with you. So that way, when you're going through whatever it is, especially if you're on a fibroid journey, that you have an opportunity to have your desires known and then to see what all is possible in terms of your options.
I love that. I appreciate you so much. One of the things what I teach is that whenever you go to a physician, know that there are two experts in the room. I can't say this enough because I see it being abused all the time. There are two experts in the room. There's the physician who's the expert in their field, but you are the expert on you, on your own body.
All day, every day.
And if they don't respect your expertise, fire them. Find somebody who will.
Say this, as far as respecting your expertise, please, if you haven't already listened to the Dr. Sophia OBGYN podcast, I have an episode called Can I Touch You? It's my absolute favorite.
Okay.
And the reason why is because whenever we go to a doctor, I don't care who they are, they should be asking permission.
Go ahead, girl. That's a telltale sign, though. That is an indicator of the type of physician that you are dealing with. Because if they're not dealing with something that is so table stakes, so necessary to build trust, right? To build trust, then that means they're already indicating to you that they're not qualified, right? Like I love that you said that. I love that you said that. I want to definitely share a clip of that. So thank you for saying that.
Yeah, I mean, I think that, you know, physicians 9 times out of 10 come from the right place. Their hearts are coming from the right place.
9 times out of 10? I don't know about that. I'm not going to say 9 times out of 10.
I think we go into this, you know, altruistically, right? We're supposed to.
Maybe, okay.
I can say that becoming a doctor was something I knew from deep within myself, deep in my heart, right? And I like to look for the good in people. Okay?
Yes, I do too.
That's to a fault.
To a fault, but I've seen so much in the medical world that it's. I've seen so much. There's so much medical bias,
and you're not the only
one.
one.
There's so much medical bias.
Those are my cousins' cousines. Those are not my. Those, you know, that's not my siblings.
It's a system that is broken. Okay,
it's a
system that is broken. It is. I've had recent experiences that even make it worse.
It is a very, very
broken system.
I know it happens even within my own family and the places where I trained. I have seen tragedies, so I'm clear.
Yeah, but that's why we can't stop being our first advocate. That's
why. Absolutely. And my point being is that sometimes people just want to be like rush, and we always have to put them back on pause and let them bring back their human. And it's not because they don't want to; it's because, like we said, we're in a broken system.
Yeah.
And so that's where you come in. That's where I come in. That's where we all come in terms of who we are, advocating for ourselves. Remember, embrace your body, embrace yourself.
Embrace your body, embrace yourself. Thank you so much, Dr. Sophia.
Thank you so much for having me.
Such a joy.
This has been awesome.
such a joy.
Same, same.
I'm going to let you go and thank you. And we're going to, of course, share this because people always say, are you going to have the replay? Because if somebody says it's 4 a.m. for you, well, you'll be watching this on the replay because we are going to post it. And this will also be available wherever you listen to your podcasts, on audio podcasts, and on my YouTube page, because we try to reach you wherever you are. All right. So thank you so much.
You're welcome.
All right. Take care. So thank you so much for joining us tonight. Please know that wherever you are on your health journey, you are not alone. All right. If you are battling fibroids or heavy cycles or chronic pain, infertility, chronic disease, wherever you are on your journey, please come to thedetoxnow.com. If you are trying to navigate a fibroids journey, we're currently going to be starting you can sign up for our End Fibroids 30-day challenge that I'm hosting to help you end your fibroid suffering. It's time for freedom from fibroid suffering. And if it's not related to that, or you see this at a later time, or you hear this at a later time, we invite you to take our free quiz, to learn how we can support you, or schedule one of our free consultations or private consultations to learn how we can support you in knowing better, doing better, so you can live better. I'm Coach Gessie. I love you. Good night.